Okay, so the tests I'll be doing today are the slocum drawers and the slocum ALRI, the tibiofibular head translation, and the pivot shift test. I have Andrew lie supine for me. Okay, so I'm going to start with the tib-fib translation. So I'm going to start by grasping the fibular head and stabilizing at the tibia. And I'm going to shift then back and forth. And you're looking for translation at the proximal tib-fib joint. He's solid, so he does not have an injury there. So for the slocum drawers, I'm going to start by internally rotating his lower leg, and I'll be testing for the anterior lateral fibers of the anterior cruciate ligament. And I'm going to perform it just like anterior drawer. He's solid there. Then I'm going to externally rotate his lower leg and test the anterior medial fibers of the ACL. He's solid there. Now I'm going to move on to the pivot shift before I do the slocum ALRI. The pivot shift cannot really show a positive test when the patient is conscious. But when you do it, you're going to press into hip flexion, knee flexion, while pushing in a valgus force. And what you're looking for is the tibia to shift anteriorly and medially. And then can I have you lie on your left side for me? And slide all the way to me. And then bring your left leg up out of the way. And then for the slocum ALRI, this is testing for anterior lateral rotational instability. So you're gonna place one hand at the distal end of the femur and one hand on the lower leg. And you're going to push into a valgus force. And what you're looking for is a clicking of the knee shifting into tibial translation, and he does not, so he's all good.
Okay, for this video, I'm going to be doing the varus and valgus test, the anterior and posterior drawer, and Godfrey's 90-90 and sag sign. So I'm going to position my patient for this now. Can I get you to lay on your back? Okay, so first I'm going to be doing the varus test, which is testing the LCL and the joint capsule at 0 degrees. So 0 degrees of knee flexion, push, and a varus movement like this. And then if I put him at 30 degrees, this isolates the LCL. Push him like that. He has no movement, so he's good. Next is the valgus. This is testing the MCL and the joint capsule on the medial side at 0 degrees. No movement at all, he's pretty stiff. 30 degrees isolates that MCL. Again, not much movement at all, he's okay. Next is the anterior and posterior drawer. Anterior drawer is for the ACL, posterior is for the PCL. Position him like this. Sit on his foot to be able to brace thumbs in the tibial plateaus. And pull forward, push backward. The anterior is for ACL, posterior is for PCL. And he's pretty tight on both of those, so he's not injured there. Next is sag sign. So what I'm gonna do, position him, and then bring his legs up to a 90, or for sag sign like this, to see if there is any posterior translation of the tibia, if it's backwards. And as I have him in this position, I will bring him up into the 90-90 position, like this, to see if the tibia has any posterior drop or movement, in which case you would compare it. He's in the same spot, so he has no posterior tear.
Alright, I'm going to be performing the Lockman's test, the crossover test, the dial test, and the external rotation recurvatum test. First, I'm going to perform the Lockman's test. Can I have you lie on your back for me? So you have the patient lay supine. And for the Lockman's test, you take the injured leg, prop it up, put about a 30-degree put them about 30 degrees of knee flexion. One hand on the posterior aspect of the tibia, one on the anterior aspect of the femur. And as I drive the hand on the femur down, I'm going to pull up with the hand on the tibia. So, 1, 2, 3. All right. And he really didn't have any motion, so it is a negative test. A positive test, you'd feel crepitus or laxity and the anterior shift of the tibia. Okay. And next I'm going to be performing the external rotation recurvatum test. For this test, you have the patient laying supine. You're going to go around the foot, grab your thumb and forefinger or middle finger, whichever one you need to reach, at the first MP joint. Slightly internally rotate at the foot and lift his legs up. You're going to look at the tibial tuberosities to see if there is a drop at the knee, at the tibiofemoral joint, indicating hyperextension of the knee. This is a test for posterior lateral instability at the knee. Andrew here really doesn't have any difference with any knee, so it would be a negative test. Okay, now I'm going to ask you to lay on your stomach for me. Okay, so you get the patient to lie prone for Dial's test. For Dial's test, you take his legs, you're going to bring him up to about 30 degrees of knee flexion. You're going to take his feet, externally rotate. This tests the posterior lateral structures of the knee. So if he was to have pain or laxity or crepitus with this motion, it'd be indicative of an injury to the posterior lateral structures of the ankle. And then you also perform it at 90 and externally rotate the feet. Has no real difference here. At 90 degrees, it's indicative of a PCL tear. And along with the crepitus and laxity, you're also looking to see just how far his feet externally rotate. If one externally rotates more than the other, it is also indicative of an injury at either posterior lateral corner or the PCL. And then for my last test, I'm gonna need you to stand up for me. Okay. And you have your patient just stand upright. I'm gonna need you to take, you're gonna say your right leg is your injured leg. Take your right leg, cross it over your other foot. And then I'm gonna take the patient and hold his arms in case he becomes unstable and he falls. I'm gonna ask you to turn your body towards the crossed over leg. Yeah, you're good. Okay, and okay, stand still. And the crossover test is going to test for anterior lateral rotary instability, and that's it.